Representative Srinivasan.
Thank you, Mr. Speaker. Good evening, Mr. Speaker. I want to thank the good chair for getting all the amendments together so we can talk about all of them at one time and then, of course, the underlying bill later on. Through you, Mr. Speaker, when we refer to as a physician, so does this apply to physicians only, all these non-competes, or would they apply to APRNs as well?
Representative Ritter, do you care to respond?
Mr. Speaker, physicians defined in lines 9 and 10 as an individual licensed to practice medicine under Chapter 370. I'd have to look up Chapter 370 to see if it includes APRNs. Through you.
Representative Srinivasan.
So through you, Mr. Speaker, we do not know if it includes APRNs as well. Through you, Mr. Speaker.
Representative Ritter.
If we could just have 1 second, we'll find out for the good ranking member. Thank you, Mr. Speaker.
Representative Ritter.
Doing the best I can. Quickly, I believe the answer is yes, that they are licensed under Chapter 370.
Representative Srinivasan.
So through you, Mr. Speaker, then, if I heard the answer right, it would apply to all licensed healthcare providers, including APRNs. Through you, Mr. Speaker.
Representative Ritter.
Mr. Speaker, doing the best I can, looking at it quickly, I think the answer is yes, but if you were ever in court, a judge would have, and lawyers would have ample time to review the statute to confirm that. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, if we can focus on the next component of this amendment, primary site. So through you, Mr. Speaker, if the good chair could tell us what is a primary site for physician practices.
Representative Ritter.
Mr. Speaker, you're a doctor. You're 26. It's exciting. You graduate from medical school. You're ready to go practice, okay? And you get a contract put in front of you. One of the things that's going to happen is if there is a non-compete, it's going to be a separate section from now on. And you're going to be given an option. Because if a non-compete applies to you when you leave, it is 15 miles in 1 year. And what you're going to do is you're going to say, okay, primary practice site is going to be one of two things. The office or facility or location where a majority of the revenue is derived from what you practice, or, and or is key here, whatever you agree to with your new employer. So that's the key here is you will have to pick. The default is where you derive the majority of the revenue, but there also could be a mutually agreed upon location. That seems innocent enough, but it can be a very big deal if somewhere has multiple locations where you are practicing or your employer is practicing. Through you, Mr. Speaker.
Representative Srinivasan.
Through you, Mr. Speaker, initially on the services in terms of the services generated, so the bulk or the majority of the services, and by majority, does the good representative mean 50% and more, or 50% and more? Through you, Mr. Speaker.
Representative Ritter.
Yeah, I mean, I think that's one way to read it. It's the majority of the revenue. So I don't know that it's 50 plus 1. If you had 3 locations and it was 40 to 38 to 22, I think that's 100 at this late hour. But the majority of revenue. And if it's a close call, then you'll work it out with your employer. You'll mutually agree to it and probably default to the second section. Through you, Mr. Speaker.
Representative Srinivasan.
So through you, Mr. Speaker, in this majority services is what we are looking at here. Or is it majority as far as revenue? Because that can be quite different between services and revenue. So we're talking about services or revenue. Through you, Mr. Speaker.
Representative Ritter.
Through you, it's the majority of the revenue derived. So it's revenue driven in this particular context. Through you.
Representative Srinivasan.
So through you, Mr. Speaker, for legislative intent, it's revenue derived and the majority of the revenue and the exact number as to what qualifies to be majority is something that can be negotiated with the employer. Through you, Mr. Speaker.
Representative Ritter.
Correct, through you.
Representative Srinivasan.
Through you, Mr. Speaker, the good chairman gave us an or. It can be where the majority of the revenue is derived, or what is the other or? As what would be the conversation and then, of course, the commitment between the employee and the employer. Through you, Mr. Speaker.
Representative Ritter.
Mr. Speaker, I'm going to make up some towns that this might be relevant to give an example. You get hired, there's an office in Manchester, and there's an office in, what's near Manchester? Is Tolland near Manchester? Sounds good. So they get hired, Manchester or Tolland, and they make a decision. They practice in both offices in Manchester or Tolland. They can mutually agree as to where the 15 miles would run from. And that's a very big distinction, but an important distinction. 15 miles from Tolland would bar you from very different areas than 15 miles from Manchester. Through you, Mr. Speaker.
Geography lessons some other time. Representative Srinivasan.
Through you, Mr. Speaker, so this or, where the office, facility, or location is mutually agreed upon and is identified. Through you, Mr. Speaker, is this done right at the time of the contract, when the contract is between the two parties concerned? Through you, Mr. Speaker.
Representative Ritter.
It would be done at the time that the parties agree, and I would point to lines 36 through 38, where we are, you get a contract, and they give you 1,000 provisions, and you sort of just sign it. Hopefully, when you're getting hired, you're more careful. But we are going to require that a covenant not to compete is separately and individually signed by a physician so that it's highlighted, and then you would get into these terms as well. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, does it say either in lines 13 or going down to 36 to 38 that this site, whether, as the good chairman said, whether it be Manchester or Tolland, and as things change in practice over a year or year and a half, can they be changed or it's written in stone? Through you, Mr. Speaker.
Representative Ritter.
Presumably, Mr. Speaker, you're going to have an underlying agreement which talks about revisions and amendments to that agreement. There's no reason this couldn't apply as well, and you could change it. Through you.
Representative Srinivasan.
So through you, Mr. Speaker, if I heard clearly, this can be changed. Through you, Mr. Speaker.
Representative Ritter.
I don't see any reason why not. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, in a covenant not to compete will not apply when it is contrary to public policy. Is that correct? Through you, Mr. Speaker.
Representative Ritter.
Yeah, I think the good ranking members are referring to lines 16 through 22, and that does say that. So that has to be consistent with the law and public policy. It has to protect a legitimate business interest, and it has to be reasonably limited in time, scope, and practice restrictions. By the legislature weighing in, if this became law on 1 year, 15 miles, presumably a court would defer to the legislature that that was reasonable. However, I suppose if you went above and beyond that with other restrictions, you might run afoul of that section. Through you.
Representative Srinivasan.
So through you, if public policy is the subject matter, and on that basis of public policy, this covenant not to compete would not apply. Through you, for public policy. Through you, Mr. Speaker.
Representative Ritter.
That is correct. And again, a court would have to determine that. And not to get too much into legal stuff, which is another committee in a lot of ways, but there are a lot of states where people challenge these. And on their face, some Supreme Courts and state levels have said, you can't have a non-compete. You can't. Not in the medical field, not in that industry. Connecticut has been mixed bag. Do I think that if you had the right facts and you went to the Connecticut Supreme Court and you said, I don't think as a matter of public policy you can have non-competes in the medical field, you would win? Maybe. I think the facts have to be right. But short of that response, we are left as a legislature to determine what we think is reasonable, and based upon all of the feedback from probably 151 people in this chamber, 1 year and 15 miles is what we came up with other restrictions that are enumerated in this amendment. Through you, Mr. Speaker.
Representative Srinivasan.
So through you, Mr. Speaker, now going into the covenant not to compete, just to, as the good chair said, we have seen multiple versions of this gone over different possibilities, and we want to see as to where these apply. So if a physician employed by a hospital or large healthcare system were to move to another hospital, another healthcare system, would the covenant of 1 year and 15 miles apply? Through you, Mr. Speaker.
Representative Ritter.
Unless you trip 28 through 35, those lines, the answer is yes, it would be applicable. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, if that employee were to go into community practice as opposed to joining another healthcare system, would that 1 year, 15 miles apply as well? Through you, Mr. Speaker.
Representative Ritter.
Yes, unless the restrictions in lines 28 through 35 are tripped. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, if a person is employed in one large group practice and then decides to move to another group practice, would that 1 year, 15 miles apply there once again? Through you, Mr. Speaker.
Representative Ritter.
Yes.
Representative Srinivasan.
So through you, Mr. Speaker, what I'm hearing clearly is, regardless whether you're moving from hospital to hospital, whether you're moving from one practice to another, or any of those permutation combinations, this 1 year, 15 miles would apply. Through you, Mr. Speaker.
Representative Ritter.
That is correct, and that is part of the amendment that we see herein that made those changes. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, now going through the various lines where the trip occurs, as the good chairman said, when would this not apply as far as the 1 year and 15 miles? Through you, Mr. Speaker.
Representative Ritter.
Basically, you can have a covenant. You can, or you should, I should put it another way. You can't have a covenant not to compete apply if you're making someone a partnership offer in your, whether it's a private physician group or a hospital, and you make them a bona fide offer, okay? In that case, I'm sorry, I should say the other way. The non-compete does apply. The other example is that if you terminate someone for cause, the covenant not to compete applies. But we also don't want a covenant not to compete to apply ever, where you say to someone, it's just not working out. Or you know what? We're going to reduce our numbers for whatever reason in this practice group. We're going to let you go. That's of no fault of your own. And people deserve, you've gone to medical school, people deserve your abilities to be provided to them and those medical services. So that's why we carve out some of these exceptions in those lines. Through you, Mr. Speaker.
Representative Srinivasan.
Through you, Mr. Speaker, so these carve-outs, so if the physician is let go for a cause, then this 1 year, 15 miles will not apply. Through you, Mr. Speaker.
Representative Ritter.
No, if they are let go for cause, it will apply. It's the opposite. It's when they are let go for no other reason than, hey, we got to shrink numbers, then it would not apply. Through you.
Representative Srinivasan.
Thank you, Mr. Speaker. And through you, Mr. Speaker, it is neither cause nor is it that the practice or the hospital is shrinking its providers, but that after the term is over, the initial contract is, let's say, for 3 years, or a 5-year contract. That's what they went into. Those 3 years are up. In another case, the 5 years are up. There's no cause here, and the workforce is not being reduced either. But the physician or the healthcare provider, in case it applies to APRNs as well, if they choose, they do not want to work in that environment, then will this restriction then apply? Through you, Mr. Speaker.
Representative Ritter.
If you're not made if you are made a bona fide offer to stay, and you were not terminated for cause, and you want to step away, then there's no non-compete. But if you simply are made an offer to renew your contract on similar terms for 3 years, and you walk away, you would have a 1-year non-compete. Through you, Mr. Speaker.
Representative Srinivasan.
So through you, Mr. Speaker, if you're made an offer to continue to stay stay for another 3 years or 5 years for the second time around. You've already done the first 3 years and 5 years. And you decide, the provider decides that I do not want to renew this contract, and so-called whatever this is offered to me at this point in my life is not good enough for me. As it was, as a good chairman said, young out of medical school, starting the practice, very enthusiastic, very happy with what he or she makes. But now we've already put in 3 years in the system or 5 years in the system, and then decides not to renew the contract, even though it's offered. The contract is offered, but he or she chooses the terms are not good enough, and the terms are no longer negotiable because they've reached the dead end of negotiations. Through you, Mr. Speaker, for those situations when he or she leaves, will these restrictions apply? Through you, Mr. Speaker.
Representative Ritter.
Through you, I believe in that example, there was a bona fide renewal contract offered to that individual physician. And if they decide to leave, there's going to be a 1-year, 15-mile restriction. It goes to the heart of this whole debate. There are probably some of us up here who say there should be no restrictions at all. But in trying to accommodate various concerns, that is the agreement that was reached, that there would be a 1-year, 15-mile. What I would say, another thing to keep in mind, is you have to enforce a non-compete. And I do think that there are many instances where they are not enforced by hospitals or physician groups, like in many professions. And if you really got to a point where you were moving on, you might see it not enforced, or you would just go outside 15 miles and you wouldn't have a problem. Madam Speaker.
Thank you, sir. Representative Srinivasan.
Good evening, Madam Speaker. Through you, Madam Speaker, so if this contract, given by the employer, whether it be a hospital or a group practice, because it happens in real life all the time, and that contract does not fulfill whatever this employee wants. Let us say partnership is not offered. You are already worked there for 3 years or 5 years, and you hope at the end of 3 and 5 years, you become a partner in that organization, in that private practice. Compensation is there, the health coverage is there, all the other criteria are met, but not partnership. That is not offered. In that case also, would this 1 year and 15 miles apply? Through you, Madam Speaker.
Representative Ritter.
Yes, I believe it would based on the facts described. Through you.
Representative Srinivasan.
Through you, Madam Speaker, if the employee decides to leave the practice, through you, Madam Speaker, if he or she decides to leave the practice, and this 1 year and 15 miles would apply, but the organization, whether it be the hospital or a private practice, has invested quite a bit in recruiting that provider to come to that area. And now he or she says, 2 years into this, you know what, I can go on my own, and I will go 1 mile, 15 miles away, and I'll be able to practice. Through you, Madam Speaker, the other components, as far as the financial components of getting that employee to work for the hospital, to work for the organization, can they all be made sure that the employee is responsible for those as well? Through you, Madam Speaker.
Representative Ritter.
You bet. Lines 39 to 44 talk about that. So it says that if you have a contract, other provisions can be enforceable. Reload expenses, things that you may put forth, you could get back in a contract dispute. Again, I don't want people to think that we are going in and eliminating every provision of a contract. Many of those would remain enforceable. We're really focusing on the non-compete aspect. Through you, Madam Speaker.
Representative Srinivasan.
So through you, Madam Speaker, the non-compete is the only one that would apply, whereas everything else will be, the person will be able to recoup back whatever has been invested in this employee. Through you, Madam Speaker.
Representative Ritter.
If they sign that contract to agree to that, like reload expenses or training or educational expenses, and there's a reimbursement provision if they leave after a certain number of years, that would still be applicable. It's the non-compete, and let's really flush that out. It's important to think about it. A non-compete punishes patients, punishes all of us who like our doctor. Tuition expenses, reload expenses, punishes you for breaking a contract that you had agreed to. That's the distinction, through you, Madam Speaker.
Representative Srinivasan.
Through you, Madam Speaker, this is moving forward as to when, so none of this is retroactive. Through you, Madam Speaker.
Representative Ritter.
No, in line 24, we talk about on or after July 1, 2016, through you.
Representative Srinivasan.
And my final question on the amendment, and I'll leave the rest for the underlying bill when we get there, Madam Speaker. Madam Speaker, will each contract for each employee will be done separately and individually signed by the healthcare provider? Through you, Madam Speaker.
Representative Ritter.
Yes, it will, through you.
Representative Srinivasan.
Thank you, Madam Speaker, and I want to thank the good chair for his answers on the amendment. Thank you, Madam Speaker.